Well, good afternoon, everyone, and welcome to another digital health download update. This one is for the month of May. So let's kick off with some brief housekeeping. Type any questions you have into the chat box and we'll address them at the end of this time for a quick Q&A. Everyone is on mute, but I will take off mute to hopefully some of our guests for later on in the meeting. This session is being recorded and will be made available on demand and via our YouTube channels. First of all, obviously, I'd like to start today's update by acknowledging the traditional owners and custodians of the lands on which we all meet today. And I am recording this on Wiradjuri land, and so pay respects to First Nations people and acknowledge elders past, present and emerging, and recognise their continuing connection to land, water, culture and community. And of course, extend any and all respect and warmly welcome all Aboriginal and Torres Strait Islander Australians who might be present today. So thanks for joining us. Okay, so the format's the same as every month. So we'll start with some latest news across the landscape. We'll have a spotlight feature today. We'll kick off with a little bit of information. We have been updating every month on the statewide referral criteria. We'll go into a bit more detail on that and then have a little spotlight on HealthLink Pro for general practice and then hopefully some Q&A. All right, so just refreshing everyone from the last couple of months, we've been actively promoting, supporting general practice in particular on Provider Connect Australia. Please, if you haven't heard from us or you're still thinking, discussing, reach out. We're more than happy to support. There's lots of resources available to you. Some of those, if your GP's catching up on this, you may have noticed New South Wales Health, local LHD, actually sent a letter out about a month ago after they did a bit of an audit, confirming that quite a few practices on the National Health Services Directory, so Health Direct Online, a lot of information was out of date across practices across the Western New South Wales region. And so the call of action was sent out by them to get onto PCA as an option and to consolidate and push more updated information to the NHSD. So just a reminder that PCA is that convenient single source of truth that allows you to manage all that information from your practitioners through to your services and your locations and publish that to multiple business partners. This one snuck in during the month of April. Nothing too much to talk about, just the My Health Record Regulations 2026. The regulatory framework was updated just to ensure the system as a whole remains, up to date, contemporary, clear, and aligns with the modernisation of digital health practices. So, but really it's clarifying those operational requirements, including security access, record keeping and registration obligations, while improving readability and supporting implementation across the sector. But clear definitions regarding obligations. So things were just tidied up, refined and clarified. But a good example is, everyone should have security and access policy documentation, keeping it up to date, reviewing it annually. And so they just clarified, that retention period and clearly limiting to 5 years, all that kind of stuff. So just dotting the I's, crossing the T's, making it current and more relevant. Also, a bit of a PR plug here from the Australian Digital Health Agency, but of course, it's not surprising in some respects, especially following the share by default announcements earlier in the year, later on last year, with pathology and radiology. And so we've now seen the 1-800 Medicare app, formerly My Health app, has topped the 1 million downloads landmark. So, and it's anticipated to grow, especially after that legislation mandate kicks in from the 1st of July with share by default. So another interesting fact is about an average of 18,000 Australians accessing the app weekly. So it is being utilised. But I just thought I'd throw this question to you all to think about, are you seeing, if the data's saying that we're seeing increased use in volume, in your practice, are you seeing more patients arriving at appointments, being quite informed, able to check medications, results, discharge summaries through the app? Are they sharing that with frontline nurse staff and GPs and generally showing an increase or improved digital literacy and health literacy along the way? So I'd be keen to hear from you about that if that is happening in your practice. So Lisa and I, later on this year, we'll focus a little bit more on this in future digital health download updates. But just a reminder, the National Allied Health Digital Uplift Plan and Allied Health Program is well and truly live and well. And Allied Health Professionals Australia website actually has a great digital health hub, interactive landing pages to step you through the process. But we are developing resources as well and support, and hopefully doing a little get to know the PHN and digital health support for later in the year. But just to clarify, the real focus here is understanding healthcare identifiers, what their role is, introducing PRODA and HPOS to that relationship and that connectedness in managing information. Obviously, My Health Record for allied health professionals, with or without conformance software, and of course, Provider Connect Australia. So if you're allied health listening to this and you've got an interest in fascination in improving connected care and learning all about how you can get connected, please reach out. Just a bit of a news bulletin. This one came in from the agency as well very recently, staying abreast of cybersecurity alerts and information. And I thought this one was quite pertinent because, as most of you who are listening will know, we're huge fans and advocates for secure messaging and e-referrals as the only way forward, really, in managing the safe and secure transfer of patient information, point of referral. And here's a little recent eFax phishing campaign, right? So those malicious actors out there that are trying to take data are tapping into healthcare practice using eFax, and they're playing to that weak point. So the agency, and we're all now aware of this recent phishing campaign, and it looks, I'd put a picture up there of what it apparently looks like. So the campaign pretends to be an inbound eFax, attempting to trick users into signing in with their account to access it. So if this looks familiar, if you haven't reported already, do not take any action. Report it internally to your IT, within your IT process, your spam processes. Take precautions such as educating staff on the email. Share this around and give people make sure that they're aware that this is a phishing exercise and to stay well and truly away. But again, a reminder: where possible, we shouldn't be using fax, eFax, or unencrypted emails, unsecure emails, because it's just not safe. Always secure messaging, e-referrals as the first port of call. Well, on to just some quick updates regarding clinical information systems. I saw this broadcast by Best Practice, which I thought was an important one, given that they have SMS communication facilities, and there's a little bit of legislation change regarding, again, protecting people from spam activities with SMS. But from July this year, there is quite a significant change coming to the Australian communications landscape with the introduction of the SMS Sender ID register. So look, I haven't got any visuals in here, but what we're talking about here is the alpha identifier code. When you get a text message from someone, it tells you who there's a particular name underneath the sender, and we need to now register organisations to the Australian Communications and Media Authority, so ACMA, and it's designed to police and crack down on scam and spam text messages. So, under the new rules, all organisations must register their sender IDs through the ACMA before sending branded SMSs in the future from July 1. Now, currently BP Premier, in particular, they are working closely with their SMS provider, so they're a gateway, to facilitate that registration for every practice ahead of the 1st of July. So if you haven't heard from them already, just pay attention to that coming your way. Now, in the meantime, if you need to set up an account with ACMA, there's still contact details there. But more importantly, if you do send clinical reminders, health awareness, marketing messages, this change will impact you. So you need to pay attention to these steps. And in the coming months, when BP reaches out, they'll need to obtain, they're going to be reaching out to obtain the registration and alpha tag information. Now, if you only use the BP comms for appointment reminders, then this change will not impact you. Just with other clinical information systems within GPs, medical directors, just a reminder, and I've been paying a bit of attention to this. It's quite interesting. I've not seen it in practice within clinics, but keen to hear from those practices using medical director. But you know, the old adage of work smarter, not harder, I think it's coming to fruition here. We're getting they are upgrade options, notably, but I think it's important within practice. And if you're looking for more efficient ways of working, I've noticed that under Telstra Health's leadership here, medical director, they do have a lot of smart apps coming on board. Last month, I mentioned the Smart Connect, which is your new referrals e-orders, working with sending orders through Lavity, for example, as the first partner in that, making it all electronic, safe and secure. But you've also got Smart Care, so that's care planning. You've got clinical support, AI-driven, targeted real information for GPs at the point of consultation. And then this one, Smart Seek, which I think is interesting. It's coming soon, not ready yet, but identifies patients who are eligible for health programs, clinical trials and research studies. And there are many more in the marketplace that Telstra Health are trying to roll out. So I think it might be an idea to pay attention on what's happening in that space and think about trialing and with certain GPs and seeing if there's any benefits in workflows and that sort of thing. Communicare, just a reminder, there's a latest MIMS, MBS and SNOMED download available. So keep an eye out for that as well. A couple of quick things on telehealth or virtual care. So with the Health Direct video call platform, which again, we support, we offer free accounts for providers out there. They've now got SMS reminders for waiting patients. So there's the option to send a waiting caller an SMS reminder when their clinician's ready. So I think that's quite handy rather than keeping them in the dark. And this one's come across our table just recently. Lise, did you want to unmute yourself? I can unmute you if you like and talk about this.
Yeah, sure. So the new hybrid virtual memory clinic is launched in Orange. It's a University of Sydney research project that's basically seeking to enhance access to gold standard memory clinics in regional and rural Australia through the implementation and evaluation of a hybrid virtual memory clinic model. So it provides early person-centered cognitive assessment and support model, reducing wait times and building regional capacity. It uses a combination of telehealth-based specialist assessments, including neurology, geriatrics, neuropsychology and allied health, and regular in-person visits in partnership with the local health services. Who's it for? It's for patients in Orange, New South Wales 2800 postcode for the time being. And it's for adults 50 years plus and 40 years plus for Aboriginal and Torres Strait Islander peoples with new or concerning memory or cognitive changes, particularly those who face long wait times or travel barriers. The referrals come via GPs or local health services, allowing people to receive memory assessment close to home without frequent travel to metropolitan centres. And we'll have some CPD face-to-face training for GPs coming up very soon. Just keep an eye on our events webpage and newsletters. Thanks, Brenton.
Yeah, thanks, Lisa. It's a good little research study, that one. Just pay attention to, by the way, with the referrals for interested GPs, just to include recent blood tests and brain imaging at the point of referral. Okay, now moving on, I just want to, as I mentioned, just another reminder about statewide referral criteria. And I've just done up this new slide just to help break it down regarding previous state, desired state, and some of those key changes. But I think most noticeable is the supply of clinical and non-clinical information in line with the state referral criteria is quite important. Now, what I might just do is just pause for a second, just invite. We've got a couple of guests on today. I don't know if anyone wanted to talk to these points in particular, but I might unmute you all. And if any of you, Susan, Suzanne, Jocelyn, if any of you wanted to talk, feel free to, do so.
Hi, Brenton. It's Joss speaking. I'm currently working on a different project at the moment, but the SRC is rolling out for a number of different specialties, as you probably have discussed previously. I think gynecology, pediatrics. We're looking at, there's a few there, including maternity and menopause clinics. They'll all be embedded in e-referral HealthLink forms as time moves on as well. And it looks like I know Western New South Wales Local Health District has started with a soft implementation of the statewide referral criteria for these particular specialties in this phase of the rollout. And internally it seems to be fielded quite well, and I think that there's more and more general practitioners and referrers, particularly specialist referrals, that are becoming more exposed to that over the course of the last few weeks.
No, thanks, Joss. And of course, I also wanted to use this opportunity just to mention, if it's okay with you, as I'm assuming it is, but it was certainly good news to hear from you last month that the move we're proceeding now with e-referral smart forms into Orange and Bathurst-based hospitals. Currently underway for go live. I've said July, but it could be sometime after July this year. But I just wanted to reinforce the message here in particular with statewide referral criteria is just to make sure, and the reason and the immense benefit and the reason why New South Wales Health is actively pushing for smart form referral platforms here is because it defaults to make sure that those mandatory records of investigations and history that accompany with that patient referral is embedded as part of the workflow and outlined for you as you step through the smart form process through LinkedIn, through HealthLink, sorry. And I think that's really exciting to see. So it should align nicely this year. And of course, the PHN will be actively reaching out to GPs when the time comes to, especially around those referring into Orange and Bathurst, that the new smart form system is a way to capture all that at the point of referral. So thanks, Joss. And just a little note there, just remember that later this year, again, we'll make announcements once they do go live that we've got cardiology, nephrology, and respiratory and sleep still on the cards. I might just move on just to quickly. The main spotlight feature for today was about HealthLink Pro because, if you're in general practice in particular, I'm pretty sure you didn't miss the news bulletins and the number of emails notifying you of the trial for the new product. And I thought I might just go into a little bit more detail if you haven't caught up with the latest news. And even some of your GPs in practice right now, when they're clicking on the link, will have notice of a change in the user interface. And we'll take a second to explain this if you haven't had a chance to catch up with this. So it is now free for GPs for a trial period. And as far as I understand, it's till the end of May. So you've got another 4 weeks or so to experience the new professional product. But these are roughly the 5 things that Pro is positioning itself as a point of difference, and always on messaging. So this is probably one of the big ones, is near instant with peace of mind delivery of messaging. What's a little unknown fact is the HealthLink standard or HealthLink Essential, which will now be called, which is what you've been used to. Messages are held in a pipeline in trust until the receiver is ready, until HealthLink itself are ready to pass it on. And so there's not necessarily an near instant message delivery. So Pro now promises to deliver an always on instant delivery. So that's an interesting point of difference. Perhaps the big one for me personally, from what I've seen, is the HealthLink Direct feature. And this is a very convenient way to find and message any provider. So up until now, practices will know, with HealthLink using HL7 send, you've got to program your address book. You've got to find the HealthLink EDI of that provider. You've got to program it into your address book so that GPs are then, from that point on, able to send a secure message using HealthLink and LetterWriter. This is vastly different now. Rather than worrying about all that, you can use an inbuilt, like a Google search feature, directory search feature, and then once you've found that provider who has an active EDI, you can actually send them the referral from within the HealthLink Direct using like a smart form feature. You can put attachments as part of that, which I think is hugely beneficial, which we know is a limitation with the LetterWriter process. So I think this is a huge benefit, and I suspect some GPs will find this quite useful. There is the redesigned web experience, which I've got a snapshot to show you in a second. Much cleaner, much easier to navigate. Support is a big one from HealthLink too. They're moving to a much faster, more responsive support, and you'll see that broken down in a second. And an updated customer contract. Now, there's actually an updated customer contract for both products, but just building in those stronger protections, clearer terms built around your practice. So this is a bit of a screen grab of what you can expect if you haven't seen it already in general practice, but you can see what we mean by the new interface. This is, by the way, a screen grab from an internal HealthLink administrator. So you've got a lot of text links below to all the smart forms, but of course in your region you won't see as many. But noticeably, you can see still down below, you've got the Western New South Wales Health outpatient referrals. You've got the different regions there, districts. But pay attention to the top, because that's the big difference in the design layout. You'll notice the big blue button, HealthLink Direct. So that's the new search feature and sending feature, all built within using a smart form type system, and will allow you to attach documents in that sending of referrals. And you've still got the specialist and referral to the private portal, which hasn't changed. That still stays the same. Now, as I said, it does come with a new customer contract, and some of the things that it's going to highlight are, clarifying practice data ownership, so all data remains yours at all times. HealthLink doesn't use it. Clinical grade service standards, so service delivery aligned with expectations of a clinical environment. Change protection and continuity, so advance notice of material changes with the option to exit, okay, if it affects your operations. Predictable and cap pricing. Any annual adjustments are controlled and notified well in advance. And of course, define breach response. So again, that's just modernising regarding data incidences are handled through the structured process that's applicable to Australia's privacy laws. But just with the difference as a snapshot, again, this is just taken directly from HealthLink's website, but it's important that, look, if the move to Pro, if after the trial period is not for you and you're happy to go back to standard, then nothing changes really. So it's called HealthLink Essential or HealthLink Standard, but it will remain as is and still give you access to smart forms, but in the old interfaces you're familiar with, at no cost, plus improved security and contractual protections. Now, practices can choose to pay, I think it's $12 per year for an updated contract to provide the modern security, cybersecurity and support commitments. With HealthLink, apparently they've assured the RACGP that this fee will not increase over time. Now, importantly, as I said, if you prefer not to opt in to either plan, then you'll continue using HealthLink as is. So nothing will be affected with use of smart forms for outpatient services and what you currently got in place. But big differences are that response time with support, much faster with Pro. As you got this immediate chat bot option. So in cases of emergency issues, there's that reaction time. But I think more importantly, HealthLink Direct, some of those features I mentioned before, are worth trying out. And by all accounts, check the information from HealthLink, but my understanding is I think they're planning Pro will come in at around the $40 a month per practice. Just no matter how many GPs users in the practice, it's just a flat $40 a month subscription fee for that. But HealthLink will make that all clear in the coming weeks as it takes the trial period off. And so please reach out to HealthLink, have discussions with them about what the options are there. So again, this is just, as I quickly wrap up, just a reminder, continuous improvement education and training in the digital health space is always available to you. Please consider digital health in your CPD self-reported activities. There's plenty of options available to. Reach out to myself and Lisa to consider that. You've got access to lots of training modules through the Australian Digital Health Agency. If you don't subscribe to the Digital Health Agency's Pulse newsletter, I recommend a lot of the topics I cover in this monthly meeting sort of is taken from those announcements. So it's good newsletters to subscribe to, and a lot of great video content too, just like we're trying to do as well on YouTube. Now, we've got, if you missed the Provider Connect Australia webinar, where we did a much more detailed run through, step by step of the registration, publishing, and you didn't register, don't worry, we'll be updating that to YouTube very, very soon. But that was recorded last week, and we'll probably continue with another update next month in June, and invites will be sent out for that as well. Don't forget, we've got a podcast as well. I'll actually be publishing a new podcast later this week regarding active script list and e-prescribing with the community in Forbes. So highly recommend you check that out as well.